HealthFirst, we're speaking with Mr. Pedro Castanho, a highly respected consultant neurosurgeon at the National Hospital for Neurology and Neurosurgery and Amethyst UK Gamma Knife Centre. More specifically, we're discussing meningiomas and their treatment, including the gamma knife procedure. Good morning, Mr. Castanho. Thank you very much for joining us today.
Good morning. Good morning. Thank you for the invitation. It's a pleasure to be here.
No problem. So can you tell us about yourself and your work?
So I've been a consultant neurosurgeon for the last 14 years. I've been working at the National Hospital for Neurology and Neurosurgery for the last 7 or so years. I do have extensive practice in neurosurgery and focus primarily in complex cranial and spinal surgery, including vascular, skull base, and gamma knife radiosurgery. I also teach at UCL as part of my academic work.
Fantastic. Well, like I said, thank you so much. It's a pleasure to have you today.
My pleasure.
Okay, so let's get started with the questions. What is a meningioma? Are they malignant or benign?
So a meningioma is a tumor that, as the name may imply, arises from the membranes that cover the brain. They are called the meninges, hence the name. Although they're not originated primarily from the brain itself, they can cause neurological signs and symptoms by compressing important parts of the brain or nerves or other important structures. They can also occasionally induce brain swelling, cause epileptic fits, or much more rarely, they can invade the brain. The vast majority are benign, and which means that they're not cancerous. A smaller proportion of them are particularly more aggressive in the sense that they have a more aggressive biological behavior, meaning that they grow more quickly or they are more prone to come back if they were completely removed. And a very, very small proportion of those will be cancerous, proper cancerous. Although they usually arise, these cancerous forms, they will arise from patients that have predisposing conditions that are rare, like neurofibromatosis. I think the reassuring aspect of it is that benign meningiomas, they do not tend to progress to cancer. So if they start benign, they will very likely remain benign.
Oh, great. That's really good to hear.
Mm-hmm.
So can you live a long life with a meningioma? And how is your quality of life potentially affected?
So yes, indeed, you can have a long life with a meningioma. And in fact, a big proportion of the meningiomas that are diagnosed nowadays are found just as asymptomatic findings on patients that had scans for different reasons, and so those tumors, they may remain quiescent, so they may remain stable for long periods of time or even for life. If they do grow, they can they can cause symptoms for the reasons that we mentioned before. So the quality of life is usually, for those that are symptomatic, is essentially normal. And if they do present with symptoms, of course, the quality can be affected, but it's highly dependent on the type of symptoms it causes and how severely they impact the day-to-day living.
Great. So how are meningiomas that are not treated monitored?
So the best imaging modality would be an MRI for patients that are able to undergo them, which is the vast majority. This has the advantage of being non-invasive, and it does not involve any harmful radiation. So it's safe and it's very effective. It usually requires, in the beginning, the follow-up interval is a little bit shorter, so that we're sure that it is not growing at a fairly rapid speed. And also if we have some uncertainty about whether this is truly a meningioma or a tumor of other description. Okay. After that, once we're reassured, then we will likely increase interval between scans, but they do require generally long-term surveillance because they can change at some point.
Yeah, I can imagine. It's good to know, like you said, you mentioned the word reassuring. And I think that as a patient, if I ever had to deal with that, I think just to know that there's that support available, I would feel very reassured and more than prepared to go through that long-term process. So if a meningioma, sorry, I'll say again, if a meningioma requires gamma knife treatment, what's involved in the process?
So this, first of all, involves a detailed multidisciplinary team discussion before proceeding with treatment. That we will look at different aspects, such as whether this tumor has really changed, whether there are some structures around that could be potentially affected by radiation or by tumor growth. So there's a number of factors that need to be taken into consideration. So once this has been discussed and it's felt to benefit from gamma knife, of course, the next step will be to meet up the patient, to discuss the options, the expectations, address any concerns and any anxieties that the patients may have, and then also, of course, discuss the risks and the hoped long-term benefits of treatment. So once we've passed that phase, once we've the meningioma was deemed to be treatable with gamma knife, and the patient is in agreement with that, that will involve treatment usually in a single session, and it's usually as a day case. So the day would start very early in the morning, usually about 7:30, slightly earlier sometimes. You'd get admitted to the gamma knife center, where the patients are given their own room, and it will start with the frame fitting. So the frame is sort of a cage that is secured to the head, and it will serve as a reference. And the subsequent imaging will help us determine exactly the point that will receive the radiation. And the intention of that is to precisely deliver the radiation to where we want it to act and minimize the spill of radiation to the surrounding brain and other structures. So that process should take probably about 10 minutes roughly. And that is done under local anesthetics. That's probably the bit that is most uncomfortable, which is just it's the patient described as a bit of a headache, a bit of a pressure, but it usually subsides within a few minutes. So there's no, aside from the local anesthetic, there's no sharp sensation or anything like that. So now with the frame on, the patient will have to have an MRI, and that MRI is a normal MRI as any other the patient will have done before, but that will be used to plan treatment. And that is quite laborious, to take up to an hour on average, and it involves multiple professionals. So it would be the neurosurgeon, of course, and also the neuroradiologist and the physicist and a wider team of nurse and radiographer, etc., just to make sure we are doing the right thing and again treating it in an effective and safe manner. So once planning is done, so the patient during this period, the patient is waiting in their comfortable sofa, and once the planning has been finalized, we will inform about the duration and we'll be ready to proceed with treatment. So treatment will happen in a quiet room, in a machine that is very quiet and comfortable. So the patient will be lying flat on a very comfortable bed, mattress, and the head will be secured to the machine to prevent movement, again to ensure the accuracy we discussed earlier. The treatment length varies and depends on the size of the meningioma and the complexity, and also in the power of the sources, because with time those sources of radiation the power will degrade. It does not mean that they are less accurate. It just means that it takes longer to achieve the same dose of radiation. So all those factors play in, but on average, I would say the time varies between a number of minutes to probably a couple of hours. Usually, it's depending on the size. Again, it tends to be shorter.
Great.
On the shorter side of it.
Oh, please excuse me. Yeah, thank you so much for providing that detailed answer. That's really great.
I didn't mention what. So once the treatment finishes, of course, we will have the frame removed, and that's usually a quick procedure as well.
Great. Okay. So how long does the Gamma knife procedure take?
The whole, I think patients, if they come for Gamma knife treatment, they should be prepared to spend the whole day, even though, because the whole process is quite a lengthy process and has different stages. But the treatment itself, usually it's between a few minutes to a few hours. But as I said, patients should be prepared to take the whole day off, because that's the whole process will take up most of the time.
Okay, great. And what is the recovery process like after the treatment? And is there anything that patients should avoid doing?
Immediately after treatment, and for the first few days, patients can commonly experience headaches, or a bit of dizziness, and steadiness, and sometimes nausea. It tends to improve, and sometimes we do give some medication, simple things like paracetamol to help with the headaches. Occasionally, we may, if we think that the risk of causing some brain swelling after treatment is particularly high, then we may recommend to do a short course of steroids. And if we think that seizures are likely, if the patient has history of seizures, we may potentially consider using antiepileptics for a short period of time. So after those few days, usually patients recover well and they are practically ready to go back to their normal day-to-day living. Some patients will go on to develop some delayed symptoms related to brain swelling, so it's important to monitor. And it is also important to, I think it's recommendable to have someone available for the first few hours, maybe for the first few days after treatment, just in case the patient develops symptoms. And one thing that is important to know is I would not recommend patients to drive home. So it's good to have someone who's able to take them, or use the public transport system.
Great. So what's the success rate for Gamma knife treatment for meningiomas?
The success rate and safety of Gamma knife is quite high in arresting the growth of appropriately selected meningiomas. So not every meningioma should be treated with Gamma knife, but we do know that those that are suitable and have indication, the control rate is quite good. It is also important. It is always important to consult with a specialist to see if Gamma knife is the best option, because it's not one size fits all.
Fantastic. Okay, well, thank you so much for speaking to us today. It's been really, really informative and interesting. And I'm sure that potential patients or anybody that needs to know about this will be feeling the same as I am, much more informed. So thank you so much.
My pleasure. My pleasure. I hope it was it will provide some useful information for people who can who are found having a meningioma and don't really know what to do.
Yeah, absolutely. Okay, so if you'd like to arrange an appointment with Mr. Castanho, visit his profile at topdoctors.co.uk.